Food donations being prepared for the community at a Pentecostal church in the London borough of Brent. The Reverend Desmond Hall shows us around.
These people are elderly, vulnerable, disabled, some have dementia, some are disorientated.
Brent is one of the areas of London worst affected by COVID-19. New research suggests that's in part because of its high percentage of black, Asian and minority ethnic or BAME residents.
Our community is struggling. Our community, as you may be aware, this side of Brent is within the double digits of deprivation. So the indices of deprivation, we are double digit deprivation here.
Figures from the Office of National Statistics indicate that people from BAME groups are 4 times more likely to die from COVID-19 than their white ethnic counterparts. The ONS points to social inequality as a major factor, and health officials agree.
BME communities are more likely to live in deprived situations. They're more likely to live in overcrowded accommodation, and many of them are in frontline work which is exposing them to the virus. So it does show that this virus, rather than being a great leveller, is exacerbating the existing health inequalities that sadly are all too prevalent in our society.
The latest numbers are in line with similar trends among ethnic minority groups elsewhere in the world. At the Reverend Hall's church we meet Jennifer Green, who does what she can to help those struggling in her community despite having underlying health conditions herself.
These people that have been to see are not well. They're sick. So some of them, where it's hard for some of them, as you mentioned, the poor community, some of them can't read. So it's hard for them to pick up a phone, or they have a pride, they don't know who to turn to.
So people are dying, as we say in the biblical terms, people are dying through lack of knowledge. Knowledge is power. And when a community doesn't have knowledge, the community's power is taken away.
In the end, this looks like an issue of poverty and of race, of minority ethnic groups less well connected to public services, more likely to be doing low-paid jobs that they can't afford to give up, and very often directly exposed to the virus as nurses, as bus drivers, often on the front line of the fight against coronavirus. It's yet another way in which this virus is tearing into societies and communities. Jonah Hull, Al Jazeera, London.